Hello and welcome to Differential Discussions. I'm Melissa,
And I'm Dave.
and today we are here to talk about chromatin. You have been asking us to talk specifically about what do we mean about clumpy chromatin versus soft chromatin. So we have a guest today, Dr. Susan Leclair, who's going to clarify for us what exactly do we mean when we talk about chromatin patterns. So welcome, Susan.
Thank you very much. Although clarify is always kind of a daunting title to go through this. I want to first tell people before we get into the slides, all of you, I'm hoping by now, have made scrambled eggs for a crowd or had people over for the Super Bowl and had to make assorted, because I want occasionally to talk about there's a prep that you do, there's an action that you do, but there's a replenishment and a storage that's also there. So we'll be moving back and forth between those three things, and sometimes using homely examples. If the one of them, unfortunately, guys, is going to be a problem for you because the best example I have is a string of pearls. And you're just going to have to cope with that one. Maybe you can think of it as rope. Here you go, string of pearls and rope. We'll do that. Because the whole process here actually starts with basic genetics. The genetics that you were taught and tried really successfully to forget, or the genetics that in college they said, oh, you learned that in high school. The answer to that is no. So they never bothered to tell you the basics, or that was somehow a day you missed class. So we are going to go through some really superficial levels of genetics, and for that, I'm going to ask forgiveness from the genetics gods, because I'm going to be using a very wide brush occasionally to go over things. And if all of a sudden you see me do something like this, it's because I made a generalization that maybe isn't all that general. So let's see if we can begin then. And for some reason, I want to start this right off. For some reason, this PowerPoint has decided that I need to put up the graphics first and the words second. So it's a Friday morning, you'd rather be somewhere else. Let's try it. Okay, so think of a cell, any cell, I don't care what it is. A skin cell, a brain cell, a blood cell, it doesn't make any difference. There are two active phases of that cell's life. There's interphase, the time in between mitosis, and then there's mitosis. Mitosis is only interested in getting you more of those cells. Interphase is where it actually works. So if we're talking about a skin cell, this is the time that the cell secretes things. If you're talking about B lymphocytes, a topic of some renown in the last several years, you're talking about antibody formation. If you're talking about red cells, you're talking about hemoglobin production. So in order to do that production, what do you have to do? You have to have somebody tell you, I need this and I need this now. So somewhere in that cell of your choice, there is a marker that was triggered, like the request from your child, I want scrambled eggs. It's kind of an external identifier that you have to do something. Willingly or not, you have to do something. So that message goes to your nucleus. Well, I guess so what is always a good question. It gets to the nucleus. It has to then that message has to interact somehow with your DNA. if your DNA is all tight and closed in on itself, that message is not going to get anywhere. But if the DNA in that cell is loose, is in small clumps, maybe kind of loose, almost sand in that nucleus, it's real easy for that, and you want scrambled eggs, to come and find that place in the DNA that means you will accept making your scrambled eggs for your child. And how does DNA do anything? Well, it's kind of like, let's see, most of the time everybody thinks of DNA as a simple a double strand. Well, when it's in a double strand, it really doesn't do anything. It just sits there. So let's say in one corner of your DNA is the gene for hemoglobin turn on. That's an easy one. That marker, that stimulant has to find that place in the DNA, and the smaller the fragments of DNA, the easier it is to find. So then that stimulant then has to somehow connect with that DNA. If the DNA is in a double strand, it tends not to be as active. What does happen is that you can stretch the DNA apart. This is not double stranded, but you can stretch these apart. Can't do it for the whole thing, that's called breaking, but you can do it in these small little bubbles. And what can you do in these replicating forks that they talk about? Sometimes you can just duplicate your DNA so that you can get from one piece of DNA to two strands of DNA. But you can also have a connection start here that says this cell is no longer a pluripotential stem cell. It's not even a bone marrow stem cell. It's going to be a red cell. And by allowing itself to be open and receiving that request, this cell then becomes active, committed to the red cell series. Well, what is the cell going to do with all the other stuff? It once upon a time could have been a granulocyte. It once upon a time could have been a platelet. Or worse yet, it could have been an EO or a baso or something else. Now it's going to be a red cell, and it's got this stuff. Okay, your kid wants scrambled eggs. I think you can put the pot that's going to boil hard-boiled eggs away because you're not going to use that. Where do I put it? Well, remember what your college room looked like before and during your parents' visits? I know when I'm doing one of these things, I take half the stuff that's on my desk and throw it on the floor. And then afterwards, I bring back the stuff that I need. So, all right, DNA is neater than I am. It has to do something with it. It has to package it and put it to one side. And one of the ways it does that is by putting proteins in there called histones. And the histones prevent then the piece of DNA that would have made primary granules in a granulocyte. Just put that away. So you're going to get these tiny, tiny little pieces of clumping. Now, I need them to be neat. I need them to be put away. You don't have a closet in your nucleus. So you have to fold stuff. You have to stack stuff. You have to be neat about it. Well, what DNA does, and here, guys, is the rope, and everybody else, the pearls, take a strand of something. You have to be neat. Put it somewhere. Well, if you just throw the strand over there, you're going to trip on it. Fold it in half. Well, you picked up half the space. Fold it again. You picked up another half space. Twirl it. You will get it tighter and tighter and tighter. That's the process that cells in humans use. It's called coiling and supercoiling. Supercoiled chromosome become chromosomes. Supercoiled DNA can become chromosomes. And so that can look like this, tightly coiled one upon the other. And it's neater, it's tighter, it allows the cell to know that stuff over there is no longer of need or of importance. And chromosomes can deal with histones that make things tighter. So, what in heaven's name does that mean for you? In interphase, when you see all of that soft, lighter stained, smoother, when you play with the fine adjustment, it tends to come in and out of almost the same plane at the same time. It looks almost velvety, crushed velvet. That's euchromatin. It's small, short strands of DNA that have been used or will never be used. So wait a minute. If a cell's got a lot of euchromatin, then it's got a lot of potential because it can do all of that stuff. The smaller the amount of euchromatin you have, the lesser the potential for that cell. So that means younger cells have more euchromatin because they're still making things. Red cells are still making hemoglobin. Granulocytes are still making, well, granules. They're still making what they're supposed to do. So the euchromatin, the active transcription of orders from the nucleus are still possible. If you are getting ready for your kids to get up and you're going to give them eggs, you might have in your head the possibility that somebody's going to want a soft boil and somebody else is going to want to have scrambled eggs and somebody else is going to have omelet. Okay, that's euchromatin. That morning, that moment before they get up and say, I want, that's kind of euchromatin. The minute they all say, I want a hard-boiled egg, well, then whether you have chives or cheese for your omelet, it's kind of irrelevant. So you don't need those directions anymore. You don't need to even think about that anymore. Put that away. And in cells, there's a lot of putting that away. In red cells, in the very beginning, the cell says, oh my God, I'm going to be a red cell. That means I have to, what do I have to do? I have to make hemoglobin. That means rough endoplasmic reticulum in the early cells and Golgi apparatus, because I need those to make a big protein called hemoglobin. I need hemoglobin. I mean, I need iron, so I need to suck in some iron in the process. Then all of a sudden the factory begins and you start making hemoglobin. Do I need the directions that said make rough endoplasmic reticulum anymore? No, I can put that aside because I'm not going to use it anymore. Do I need the directions that say this is how you make hemoglobin? Well, probably for a little while, because remember, you have to go through all of those different hemoglobins. But once you get down to adult hemoglobin, I don't need the other directions. Put those away. The putting directions away creates the change from euchromatin functionally to heterochromatin. Euchromatin is open, easy, velvety. Heterochromatin is going to be dense, dark, kind of like almost an airline overhead bin when people are trying to stuff the last three things into it. So you get this sense of denseness, this sense of impenetrability. You get the sense of unevenness, because one bit of heterochromatin is going to be tall, and another one's going to be flat, and another one's going to be on its side. And so they're going to be lumpy, and they're going to be uneven. And again, they're going to be this denseness to it. So that's heterochromatin. Oh, well, I just said that. So basically, euchromatin, younger cell. Heterochromatin, older cell. Now, there are cells that cheat, and those are lymphocytes. And so anybody who wishes to hiss at them can do so now, because alone of all of the hematology cells that we look at, lymphs can flip between these two. Typically, the rule is, as you pack away your euchromatin into a heterochromatin form, that's it. You're not going back. It's like going from childhood to teenager. Much though many of your relatives would like you to go back to being a child, you is a teenager, and that's all there is to it. And eventually, you will change from teenager to adult. That's not something you can go back in. It's a one-way trip. Lymphocytes, on the other hand, can be full of euchromatin, and then they can collapse in on themselves, and they can have a lot of heterochromatin. And that's a kind of a resting state for them, because they alone can move from heterochromatin back to euchromatin. And it's part of the process we call reactivity or immune response in them. So they, as usual, cause more trouble than the others do with maturation. Okay, the thinner and wavier the chromatin, the more likely it is that it's being actively replicated or actively used. Of all of the cells that you see that have this thin, wavy, like putting your hands into sand and moving your fingers through sand, there's a wave that comes on there. What does that mean? It means that the cell is very metabolically active. It's thinking, it's moving, it's reacting to things, bad word. It's responding to the situation. It's monos. Monos, unlike granulocytes, never really get to a dark, clumpy stage of heterochromatin. They stay this thin and wavy because what do? Granulocytes eat, yay. You know, monocytes, on the other hand, they recognize trash from infections. They can either kill or degrade. They can present in some form an antigen to your immune system for a decision as to whether or not an immune response should be there. They react to cold and heat and 6,490 million different medications. So they're constantly moving in tune with their environment. So they never really get a lot of heterochromatin. They stay in this wavy euchromatin state. But most of the time we see them in the bloodstream, and even to a certain degree when they're out in the tissues. They will stay that way for maybe a day or two before they commit to whatever it is that they're doing. And then the heterochromatin will come in. But we look at mono sometimes and go, oh my God, it's thin, it's wavy. Maybe if I cross my eyes and look at it slightly out of focus, could be possibly a nucleolus, and then you drive yourself crazy. Well, monos have wavy, thin, stretchy kind of chromatin because they're always active in responding to things. Usually at about this time, I would say something boring like got it or okay, but we'll just plow through. So how does this supercoiling really work? I mean, it's nice to talk about ropes and it's nice to talk about pearls, but how exactly is it done? And it's done in this process of just repeatedly twisting the DNA tighter and then periodically throwing in one of those histones, which bind and make it permanent. So if you've got a long rope, maybe, and you double it, you just want to put a knot in it so it won't come apart. And then you can double it again, put another knot because it doesn't come apart. So think of histones as being spacers, as being preventers of inappropriate activity. So you can take a double strand of DNA and keep twirling it around and twirling it around and twirling it around until you get to supercoiling, which is that super dense presentation. So now it isn't just what does euchromatin look like and what does heterochromatin look like, but it's really three phases. What does euchromatin look like? What is coiled euchromatin look like? And what is supercoiled? So there is a, as with everything else in hematology, there's a change over time. In the red cell, you start off with no hemoglobin, and then there's a little, and then there's a little more, and then there's almost all that you need, and then there's all you need. And so there's a change in the cell. The more hemoglobin you have, the more it starts dismantling the Golgi apparatus. It doesn't need as much. It starts dismantling the RNA. It doesn't need that as much. So there's this change over time. So no hemoglobin, a little bit of hemoglobin. I got it. I know what I'm doing. I can drive by myself. Oops, that's an accident. And then I'm an adult, you know? There's that movement. And if you think of these cells as being alive and reacting to what's going on, then it all of a sudden makes such great sense that these cells would do this. Okay. Okay, so let's see what's real and what is not. Remember, more euchromatin, the younger the cell. Let's look at this poly for the moment. Dark, lumpy along the nuclear membrane, uneven, big wads of dense, irregularly shaped chromatin versus slightly lighter. Remember, it is still alive. It still has to function. So it's got a little bit of functionality to it. And compare that then to this band. Not the same coloration, not the same texture. Yeah, you got a couple of dark places here that are lumpy. But remember, this is a teenager. You know, it's going to be lumpy. It's not going to be even. It's going to have some significant parts that are heterochromatin. But look, the sides of the nuclear membrane aren't quite as thick or patched as this is. These are almost free-floating aggregates. They haven't quite gotten to the edge of the nuclear membrane yet. And this is a metamyelocyte. Again, yeah, you got small groupings of DNA, but look at how thin that membrane is. And what do you think? Maybe it looks like a checkerboard on acid or some other hallucinogenic. It's kind of twisted, but you get the sense it's about half and half. Which, when you come to think of it, in this cell, in terms of functionality, it knows it's going to be a granulocyte. It's already undergone a couple of mitotic divisions. It's made all of the primary granules that it's going to make. It's made most of the secondary granules. It needs to do some outside work, you know, motility, phagocytosis, antigen recognition, and stuff like that. But it's moving along. And then let's just look at this blast for a moment. There is a nuclear membrane there. It's just really hard to see. And it's soft and almost cotton ballish when you think about it. It's got these little almost extrusions of nucleus that are coming out because that nuclear membrane doesn't have any strength to it. It doesn't have any support. So it's easy to push around. And yeah, you have nucleoli that are easier to see because all this stuff is just very soft and loose. So lots of euchromatin, young cell. Throw some primary granules on it and you get a pro. Then you can go to a myelocyte. It's working on it. Then go to a metamyelocyte. Look at the chromatin pattern. You got a little bit of stuff up here against the edge, but not a whole lot. A little tiny bit more. And the heterochromatin, the dense stuff is a little bit darker still, more of a noticeable membrane. You're not going to punch that membrane around despite what it looks like. And then you get to poly. The same thing is true with lymphs. When you look at these, small, round, resting. There was a time that this cell was used exclusively for size, because it's about 7 microns-ish in diameter, maybe a little bit larger, so the nucleus is, but this one in particular is about the size of a red cell. So if you worked in a lab that was too cheap to get you an ocular micrometer for the hematology lab, and somehow micro always got them, but heme almost never did, you used, who knows, you used the small lymph to check the size of your red cells. Why did you do that? Because we didn't know what it did. We knew that they were increased in some diseases, but we had to wait for Bob Good to invent the immune system to be able to see what was going on. So what do we now know about these cells? Yeah, they got a lot of heterochromatin around the sides. Yeah, they got lumpy, really dense heterochromatin here. So this cell is should be dead, or should be at least 87 years old and not going to do much about it. But when you stimulate this cell, it can reverse itself into a reactive lymphocyte because it's being stimulated to unpack itself. Remember after your last vacation and you got home and you took your luggage and you opened it, everything kind of sprung out, because my guess is that you didn't pack it quite as neatly as you did on the way out. So all of a sudden, everything springs out. The cell has to get larger because the nucleus is now, stretching itself because it's got all of this euchromatin in here. Well, what's it trying to do? It's trying to respond to the T cells that are sitting there smugly in the corner because they don't have to do the work, saying, thou shalt make an IgM antibody directed against X. And after you do that for a few days, I'm going to make you change that and make IgG antibodies against X. So this is now a cell that has to recognize directions, obey them, put up a structure that will allow them to make some kind of antibody. So that means rough endoplasmic reticulum. It means the possibility of a Golgi apparatus. And you got to do it fast because you're going to have to respond to this. This takes about 6 days. So shockingly, in the old days before medical treatments, you would hear in ancient movies, well, we'll just have to wait for a week. And if they end up doing well, if the fever breaks at the end of a week, you're good. Any woman here who has reread and cried over Little Women, the novel, know that Beth gets sick and the doctor at some point says, we're going to have to wait for about a week to see if the fever breaks, la, 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 la. Well, what is the physician of the 1840s saying in today's lingo? You got to wait to find out if the antibodies get formed, and that takes 6 days. So let's do it. At any rate, it takes 6 days. This guy's working really hard for 6 days because it's got to build that rough endoplasmic reticulum. It's got to make a Golgi apparatus. It's got to figure out what kind of freaking antibody that it's got. It's an IgM, so it's got the multi. Okay, and I gotta make it look like, ooh, wrong season to be talking about home plate, at least in the Boston area. So let's skip that. But you have to do a highly complex thing. Why are we surprised it takes a long time? And in the process, why are we surprised that this now has reverted to a lot of euchromatin because it's really, really busy? And yeah, can you, again, if you squint and look kind of sideways, can you almost but not quite think that there could be nucleoli in those cells? Sure. What are nucleoli made of? Messenger RNA. So you want the most active, and I think you can see it in this one, you want the most active pieces of DNA to get as close as they can to the nucleolus so that communication between the messenger RNA and the DNA allowing for transcription occurs easily. You know, how many of you over your life have said, oh yeah, I really, really, really want to live 2.5 hours away from where I work? You know, so you want that stuff closer to the nucleolus to get activity going. Don't worry, there aren't that many. Red cells. It happens in red cells as well. In the normal series, you got no hemoglobin, maybe a little, yeah, okay. Oh, look, nucleated red blood cell. So you see a process for nice red cell transformation here. You see almost, but not quite the same in B12 deficiency. And I picked B12 deficiency because it's a nuclear, it's required in the nucleus for nuclear function. So these two, actually these three, they're all what we tend to call nucleated red blood cells. They're orthochromic normoblasts. They're supposed to look like this. The nucleus is supposed to look like this. Day late, dollar short in each one of these. They've not been able to undergo that supercoiling to make it as dense as it should be. So there is always a disjunction between the maturation of the red cell, you can see that, which is really hemoglobin here. Yeah, I'm getting hemoglobin. And a disjunction with the nuclear maturation, which is not so much. So you get an asynchrony. Nice word that we use often with this, an asynchrony in maturation. Here you go. Now, little drum roll here. For those of you who think that I'm only talking about hematology, these are clearly not hematology cells. These are parasitology. This is, so I'm telling you this so that the next time somebody in micro says something, it's always nice to have something in your back pocket. There are two entamoebas that are found in the GI tract. One of them not so much of importance, the other one of critical importance. Entamoeba histolytica, which is the one that causes raging, rampant diarrhea, up to 40 or more bowel movements in a day, which means you're not moving from one room for very long. What do you think? A cell that eats into, a parasite that eats into the wall of the GI tract, that causes inflammation. So it's got to react to the inflammation. It's causing all kinds of cell damage. It's got to react to that. And oh yes, in the process, it's going to interrupt your GI tract, normal flora and water balance. So it's got to also keep itself functional with the change in osmolality and in electrolyte changes. What do I need for a nucleus? I need one that's active. I need one that's busy. I need one that's functional. I need one that doesn't have much heterochromatin. I have an even, thin nuclear membrane here. Yeah, occasionally you can have one dot, but most of the time there's this thin-walled, smooth chromatin nucleus. On the other hand, Entamoeba coli, not so much in terms of disease production. I mean, it's an irritant, yes, but it nowhere causes 40 to 50 bowel movements a day. Well, let's look at this. A much thicker chromatin pattern around the edge. It's uneven, pulls in and out. Yes, again, you can have one of these, but look at the thickness of the heterochromatin here. Look at the thickness of the heterochromatin here. So when somebody in micro comes out, as they sometimes do, they'll open the door and sometimes say, oh, we got a histolytic in here. In hematology, you can say, oh, did you notice how much euchromatin there was in the nucleus? Because, there are sometimes you just gotta. That's what that's called. Okay, so the most common problem that most people have is it a band and is it a poly? And we could spend days and probably carafes worth of wine arguing about the various, because we still have them, nomenclatures for this. I am going to stick, so don't tell me whether or not it's segmented, and don't tell me whether or not you think that it's indented more than 50% of blah, blah, blah. Just look at the chromatin. That's what I want you to look at. And I want you to compare it to this guy, which I think we all can agree is the end product of maturation. Okay. These bands here, just what I'm going to call them, so just deal with it. They're puffy. They're like those big long balloons that you get at the fair that are straight. No, they're puffy, they're sausage-like. Their nuclear membrane here is thin. Yes, you have a couple of large aggregates of heterochromatin here, but in essence, that nuclear membrane is relatively smooth. And there's a lot. There's some euchromatin that's here. And this one probably easier. There are two big aggregates of heterochromatin here and here, maybe a third one there, but the rest of them are kind of scattered. That's not a fully matured poly. This, on the other hand, look how dense it is. I don't care about the segment or the twists, I suppose, although it could be a balloon after somebody's made it into a dog. At a fairground, I was barely able to twist. So what do I know? Look at the edge of this. It's dark. It's thick. That aggregate takes up much more space than the aggregates here. You got more of them here. Very, very dark. And these openings down here, they're not actually euchromatin as much as they are, I don't know, air pockets in the sausage. It's just the way the cell has rolled across, and as it settled, it pulled a couple of pieces of DNA off to the side. So it's not really euchromatin. It's really just spaces that can occur, as opposed to the lighter areas here. They're still light purple. If you want to go by color, they're spread evenly and gently across the cell. So bands, puffy, large clumps, but no tightening of the nuclear membrane. It's a relaxed sausage where, whichever name you currently want to use, for the end cell, they're twisted. They're dark. It doesn't make any difference then when you look at this cell, say, well, there's no visible segment. True. Look at the chromatin in this cell and this cell and this cell and tell me if they're different. They're not. So what was it in geometry? If one thing is equal to another, then, they're equal to each other or something like that. That's kind of what you're looking at, is the darkness of these cells, as opposed to the lightness of this one. It is a technique I have always used, and my students hopefully will remember fondly after this is over with, that I always told them, go find yourself a poly before you do anything else. Before you start your differential or anything else, find yourself a poly. Is it more pink than you expect? Is it less pink than you expect? Do you find the stain to be adequate? Take a good look at what the polychromatin looks like. Now that you got that in your head, don't compare everybody else to the cell you just saw. There's no harm in using the information that's made available to you. That would be almost like saying, well, I'm going to make a Napoleon, a French dessert, but I'm not going to use a recipe and I've never made it before in my life. Could you look it up in the recipe book? Well, this is a cheap, easy way to look up what do the cells look like in this person at this time. And what does this cell tell me? They were alive until I caused them to dry up. What are they trying to tell me? This one's trying to tell me it likes platelets.
Who doesn't?
Well, and if you like platelets, how much do you like platelets? Is it just kind of a friendly meeting, or do you go to this bar a lot? How do you handle that? These cells, this is definitely a poly. What granules are you seeing? They're small. They're grainy. Well, then I shouldn't be comparing this cytoplasm and saying only cells that look like this are polys. This is definitely a poly. So look at the cell, find yourself a good one, and it will make your life easier. And I'm done, and I did it in less than 5 hours. There you go.
Susan.
Now, I suppose I should say something like any questions, although, you're ready to leave because the lecture's over.
No, I love the way I mean this as in the best way possible. I'm gonna steal some of your presentation, I think.
Yeah.
I love the way that you kind of put it. Because teaching chromatin pattern is kind of like is from my limited experience, it's kind of like that last level of heme morphology.
Hopefully there were a lot of, yes, I got it.
Mm-hmm. Yeah, I think there will be, because we have had, Dave and I talk a lot about chromatin. You have to when you're looking at diffs, and a lot of people have been like, well, can you describe chromatin more? And I think it was fantastic. It was exactly what I think our audience is looking for a description, and it was much more eloquent than what Dave and I could say.
Oh God, I'm a caveman. Yeah, I mean, but
have you ever cooked scrambled eggs? I mean, that's first get the pan, make sure the range works. Start with prep and go work your way through. It's the same thing. It's what the cell is doing.
I think just looking at some of the cartoons that you have that show like the twisting, right? And I can kind of use my life experience, and like if I take a string and I twist it, I can feel how it coils up. So there's all things like I knew on an academic level, but it certainly made my brain I like the
you were sleeping during some of those lectures.
It's what is the thing like you
too late for me to change grades, so.
Yeah. you retain X amount of whatever you learn, right? So that must have just rolled out of the head, I guess.
I see.
I have sympathy for our MLS students. They're inundated with many subjects all at once, and it's a tough major.
It's also hard because there's no firm footing. In micro, it's the one good thing I'll say about micro. But it's true. All of their sages died a long time ago. All of their and all of their apostles died a long time ago. So when Burgess says, "Thou shalt no longer call this organism this, but that," everybody switches all at once.
Yeah, yeah.
I know hospitals that still call reactive lymphs Downey cells because, well, Dr. Downey worked there.
Yeah.
Okay. Or I hear people say other names of something else. You say, well, that guy died 30 years ago. Oh, but his apostle is at your hospital. I got it. So we end up having to learn 15 different nomenclatures in order to, because there's what was it? Hemocytoblast was one of the names that you could use for one of the stages of red cell production. And you go, we have not yet reached that level of discipline.
Yeah, I've learned that the hard way, I think. Yeah.
And it's very unfortunate because you have people who you don't know what the training history is of your physicians. First of all, we don't even know. We're pretty sure they've never had a course in lab medicine. So you move that out of the way. So they understand nothing. And if you have, I don't know, if you have hospitalists and then you have the staff and then you have the people who are covering from someplace else, it is possible that you have three totally different appreciations of things. I worked at a place once upon a time that did segs and non-segs. So the non-segs reference range was 1 to 15 because they were non-segs. The people who worked overnight in the emergency room were from Boston, from hospitals where they used banded poly. So I used to have to go in when I would work 11 to 7, which I adored. But because of this, I would go into the emergency room with the report behind my back saying, we need to talk because you have an 11-year-old with a hot belly. I understand that. If I give you this that says 50% segs and 15% non-segs, you're going to bring him to surgery because you think he's got appendicitis. And I'm telling you that this says, give him a high colonic and send him home. And that level of interaction is so sorely missing that it causes, not only does it cause problems with the system that we don't have, it also can kill people because in that instance, that kid could have gone for unnecessary surgery. Is it possible that something might have happened during the surgery that gave him a complication? Sure. Life's a risk in that sense. Is it possible that somebody could have perforated a bowel in the process? Only if you're a really bad surgeon. But all of you who are listening, you don't have a list of good and bad surgeons for your family to use, do you? So, everybody's got it. So this kid could have walked into the hospital with a bellyache and come out dead or come out with a resection, 4 weeks later. And I'm going to put the onus on the laboratory, we do not say, if we're a teaching hospital at the beginning of July, the rule is don't get sick in July, right? Why are we not out there in July or in June, whenever their orientation is, and saying to these residents, this is what our lab report looks like. This is what it means. You have to tell them what it means, because if you don't, they will assume, I'm not sure what they will assume. As one physician told me once, well, no, there's really no need for a course in laboratory medicine. You just kind of pick it up as you go along in your 3rd and 4th year. All those willing to risk their lives by putting them in the hands of somebody who picked it up.
And there's an implication there too, that obviously there's an interpretation, assumptions that go into that learning. That's not good learning, right? Like
yeah, because what's the old joke? What's the name of the person who graduates last from medical school? Doctor. So, and I'm not, and I actually, I like doctors. Some of my best friends are doctors, but there are so many things in the pre-analytical and post-analytical. They don't need to know what method you're using or how long it takes, except of course the SED rates when they want them done still. And report it out early because you can just double the answer. They need to understand, this for quite a while till he learned, my cardiologist was miffed because I didn't use their laboratory for my lipid studies. And finally, he said to me, "Why don't you come here?" I said, because I don't trust that you understand the difference between the methods. I know the method that you use here, and it's different from the place where my entire history of lipid studies have been done. I choose to remain consistent over your choice of whatever it is that your choice is. And eventually it was kind of a, yeah.
Something that they might not consider, right? That methodologies can have these inherent biases that could shift your reference range.
Up to comparing point of care testing for glucose and regular glucose.
Oof.
They're not the same, but it's a good example. Bands and polys are a good example. In the way back, there were stats at night were done by lesser machinery because nobody on the day shift trusted the night shift. And in one place I knew the night shift hemoglobin, if that's all they wanted, was an oxyhemoglobin. You want to discuss with me the difference between oxyhemoglobin and cyan methemoglobin methods at 3 o'clock in the morning to a physician who never had a lab test exam in his life. No, you're talking, it's not fair to anybody when that happens. My personal favorite, and Melissa knows this very well, is I was at this meeting. There was half patients. It was given for patients, and they could invite their physicians.
Oh, well, wait, Susan, hang on one second. This is a good one for the patient advocacy one that we want to do. So don't tell that story here. Hold on to that story.
Okay, no, so I'll change this then. Okay. We were talking about polycythemia. And we talked about treatments because the early treatment of polycythemia is therapeutic phlebotomy. And a patient asked, what makes the cells better if they're smaller? And the answer that somebody said was, well, it just makes it easier for blood to flow. And another physician said, it doesn't make it easier if they've got a 6 million red count, even if they're tiny. You still got a mass issue, and everybody looks at me to adjudicate this.
Yeah.
Well, is it a mass issue, or is it a hemoglobin and hematocrit issue? And how do you work those? How do you explain to a physician who has never, it's 11 o'clock in the morning, the morning work is over with, you're calm, whatever morning rounds or whatever are done. So we have a non-stress situation. Imagine trying to explain to someone, a physician who's never taken lab medicine, what an increased RDW is and what it does to the hematocrit. Gibberish. We're talking gibberish. Unless you can provide, the laboratory, can provide, I don't know, most hospitals have rounds. Once a month, somebody get up there and say, la, 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 la. You know, yes, in immunoelectrophoresis, sometimes you report it out as micrograms or milligrams, and sometimes you report it out as grams. You got to look at the ending to figure out what the answer is.
I think that the last 5-10 minutes of this conversation is a great segue into telling people that Dr. Leclair is going to be doing a podcast episode talking about patient advocacy, and there's going to be a lot more of what we've just started hearing in that episode. So, Dr. Leclair, we'd love to thank you because your chromatin lecture was fantastic. It was exactly what we were looking for our audience. So, thank you so much for joining us today.
Yeah,
You're very welcome. This was nice to do.
And thank you, everybody else. Thanks for listening.
Thanks for your time.